So I guess I'll introduce myself first. I'm Sam Whiting, and I'm a Teaching and Research Associate in Occupational Therapy and an occupational therapist. So welcome, and I guess I'll just pass on to the rest of the guys in the call.
I'll go next. So hi Lottie. I'm Jen Rolfe, and I am also an occupational therapist, and I'm a lecturer on the occupational therapy programmes at the university.
Yeah, I'm Claire. I'm a student occupational therapist and currently studying year 2.
Hi Lottie, I'm Matt, an outreach officer at the University of Plymouth. I graduated about 4 years ago from graphics illustration, but if you've got any questions about student life, accommodation, fees and finance, anything like that, just pop it in the chat and we're happy to answer it for you today.
Yeah, and likewise, if you've got any questions throughout, just I can't see the chat now, but I'm sure the rest of the team can pass those on.
Definitely.
Okay, well, yeah, so I guess this is just a session really to talk through a little bit about what occupational therapy is, answer any of those questions from a sort of professional background point of view, and give you a bit of an insight into the world of OT and potentially some of our experiences in practice and where we've come from. And I'm sure Claire will have some of her sort of experiences of learning with us at Plymouth, but what it's like to be an OT student, and then just a little bit about what it's like to study, some of the events that we've covered, some of the research that we get involved in, as well as a programme. Okay, so usually when we start off these kind of sessions, we pitch out the question if anyone in the group has ever met an OT, and if anyone knows anything about OT. So feel free to write in the chat box if you would like to, if you have any answers to those questions. Or I could even be really cheeky and ask Matt if nothing comes through in the chat.
I'll let you know if anything comes through in the chat.
Okay.
I've never met an occupational therapist before, but now I've basically met 3 tonight, so...
Well, 2.5.
Yeah, absolutely. Okay, so I guess, Matt, because you've never met an OT, you might not know anything about OT either.
No, definitely. I'll definitely learn something. Lottie's just come back saying, I've spoken to a few OTs, one working in a forensic setting.
Okay, cool. So very specialist role, I guess, in forensics. I've had a little bit of experience in forensics, but it wasn't my main background. But yeah, so you'll have a bit of an idea of a potential role that OTs can do. So working in mental health, working in that sort of sector where you're working with people potentially with quite significant mental health conditions. So you've been chucked in at the deep end there by the sounds of it, Lottie, with that type of experience, but we'll talk you through a little bit more. Okay, so really this is kind of where we think about sort of the different roles that OTs have in practice, and the sort of people, patients, client groups that we also come into contact with, and also other members of the MDT. So I guess this might be a point where I could probably talk about my own experience, a hospital setting mainly. So I worked in a big acute hospital, and I worked with people with a range of very sort of long-term conditions. So people who were struggling from a respiratory point of view. So people who were living with conditions like COPD or asthma and bronchitis, and it meant that they were really short of breath and struggling to breathe, doing all sorts of day-to-day activities. So my role was about giving them strategies to manage that condition as effectively as possible so that they could still live the life they wanted to live. And whether that was going out and meeting friends, very practical day-to-day activities such as toileting and showering and getting dressed in the morning, to more complex roles such as, being able to still play with grandchildren and work effectively. So it's a real sort of mixture of illnesses and injuries that I worked with. But also, you've probably heard of some of the people that we would work with as professionals. So thinking about some of our physiotherapy colleagues, dietitians, social workers, doctors and nurses, speech and language therapy. We come into contact with a lot of those professions as well, and are quite often the person bringing a lot of that information together, so that looking at not just a patient, but seeing them as a person and the things that they enjoy getting up to on a daily basis. So that's kind of a bit of my background in a nutshell. Jen, I don't know if you want to share, if you've got any nuggets of wisdom.
I'm not sure about wisdom, but I can share a bit about my experience. So before working at the university, I worked in adult social care. So essentially, that's what you might know as social services. And I worked in the community with adults, so anyone over the age of 18 who had some kind of either illness or physical disability that meant that they were having difficulty with their independence at home. And what my job would be was to essentially help people to either to use equipment in their homes so that they can be more independent, or also on the other end of the scale, adapting people's homes so that they could live independently in them. So the sorts of adaptations you probably would be familiar with would be things like a stair lift, or a level access shower, or a wet room, and then also we used to seek funding for downstairs extensions for people, for example, so that they could sort of have a downstairs bedroom and a downstairs bathroom. People experienced so lots of different illnesses, people with neurological conditions, people who'd had strokes, people who had more sort of degenerative conditions. Sam mentioned people with respiratory conditions, so I worked with a lot of people with COPD, which is chronic obstructive pulmonary disease, and a real range, but also lots of older people who had arthritis, and just having arthritis meant that people really struggled to just mobilise or walk and get around their home and get from room to room. So a real variety of different illnesses or conditions or physical disabilities. And generally, in terms of other professionals, I worked with physiotherapists and with social workers, and sometimes community nurses as well. But actually, the people that I would be most involved with a lot of the time would be people's carers, and working closely with people's carers to make sure that the people were getting the support that they needed to live at home. That's me in a nutshell. Oh, and I suppose it's also worth saying that now I also work alongside this job. I work privately, so OTs can work in the private sector as well. And so I've got a small company, and I work, again, I do a similar work, but with people who don't necessarily qualify for the support through social services. I work with those people often through charities. So there you go, that's me.
Fab, thanks Jen. And then I guess to get even more up-to-date information about what OTs are doing on the ground, we've got Claire, who is on placement at the minute.
Yes, I am. At the moment, I'm actually doing a role emerging placement, which we're classed as pioneers at the moment for the university, which is really quite exciting. So I'm working with another colleague, another student, and we are looking at access to a local outdoor theatre company, which is under canvas. So we're looking at access, whether that being physical disabilities or any hidden disabilities that people might have, which is quite exciting, really. And the reason why I came into OT was the fact that I have an autistic son, and obviously OTs can work alongside children with a range of disabilities, but obviously from a personal point of view, it was more with regards to sensory integration. So the sensory needs that he had and the communication difficulties that he had. So that was one of the reasons. But there's lots of people in my cohorts. So some are working with rheumatology, some are working. There's lots with older people. Within, I think there's few in forensics, aren't there, Jen? There's lots of different people.
There's a handful of students in a mainstream school at the moment as well. I'd like to plug that in wherever I can.
That's really good. So there's lots of places where an OT could work, but that's from my point of view at the moment. So it's quite exciting.
Yeah, definitely. Thanks, Claire. And it's nice to get a feel for sort of why you got into OT in the first place as well, and I guess highlighting the role that we play across the age ranges with sort of small babies and children all the way up to your sort of older adults. So thanks for that. Okay, so yeah, I guess this just highlights the range of areas that occupational therapists can work in, and this is just continuing to grow. So I think the real strength of being an occupational therapist, I think, is that you can still be, although the training is, you all get the same experience as a student in your kind of study, your placements give you this opportunity to explore these different areas of practice. And then more some. So when you go out into sort of the working environment, you can still be the OT you want to be. So if you have interests in working with children, in paediatrics, in respiratory, in prisons, in schools, in intensive care units, in hospices, in the community, physical health, mental health, there's lots of options for you to change your mind and change it again, but still be an OT. So I think that's the real strength of, once you've got that training behind you, you can dip into lots of different areas of practice, which I think keeps it quite exciting. Or even education, because I guess the two of us in the room here are working in education now too. Yeah. So, lots of opportunities. So we've told you a little bit about what we've done and some of the potential areas that you can go into once you're qualified, but what do we actually do? And I guess that's quite important to explain at this point. And again, usually at this point, or when we're at events, we usually throw out the question, what is your favourite occupation? And what we mean by occupation is all the things that you do within your day, within your week, within your year that make you the person that you are. So it's the day-to-day human movement, functional stuff, but also the bigger stuff that could be your hobbies, your interests, all the things that you do, whether it's a parent, looking after family members, the job that you might have, all of the things that make you the person that you are, that you value. And I guess it's about thinking what your favourite occupation is, your favourite activity or hobby. So feel free to take a minute and have a think about, something that you do that maybe you're known for, that your friends know that is something that you're really into. So consider that for a sec.
What's yours, Sam?
What's mine?
Yeah.
What is mine? That's a really good question. So I think, although this is something that changes over time, but I really, really enjoy spinning at the gym. So I don't like the gym in any way, shape or form normally. I really like the idea of just giving it absolute beans on the, on the exercise bike.
Yeah.
And I feel really good afterwards, and I really miss that at the minute. And it's something I dip in and out of over the years, but now that I can't do it, I really miss it. it's like the one time where in the day where you just move really fast, like you just don't move at all otherwise. And I really miss that. So I think just being active, I do miss. And I can't emulate that at home. I have a bike at home and it's not the same.
It's not the same.
I think it's that competition. No,
I definitely agree with that.
You're slightly looking around at the others thinking, I'm going to go faster than her.
They haven't turned their knob up as much as I have. I'm going to turn my knob up fast higher than theirs.
Yeah.
It's great.
And I think I live near Dartmoor as well. So I think I like being out and about on Dartmoor and probably take it for granted how lovely it is to be able to just walk somewhere and be on the moors, which I also really enjoy.
Nice.
What about you, Jen?
Well, so you and Claire know me well. I think you could probably guess what one of my favourite occupations is, because I always talk about it in teaching, and I think I harp on about it in our meetings as well. So have a stab, have a guess.
Running.
Running. Riding a bike was a good guess, though, Matt. I'll give you that.
A bike behind you.
Yes, running, absolutely.
I was going to say running or rocking.
Running or yeah, both of those things. But actually, something like what you said about missing spinning, I always knew that, like, my family mean a lot to me and I'm really close, but I'd forgotten I didn't realise how important spending time with my brothers was to me. And one of my brothers, fortunately, is really close by, but the other one lives in Leicester, which, as you know, has been under really strict measures pretty much throughout the whole of this period. And so I haven't been able to hang out with my brother, face to face since Christmas. And I hadn't realised how important that was to me. And it's really, that hanging out with my family, running, rocking. There you go.
And what about you, Claire?
So if I could turn the screen around, there's my bike. So I'm on the bike 45 minutes a day normally, because I'm not out walking. I'm kind of staying in as much. But I really enjoy singing. I run, I'm part of the youth team at church, so really enjoy that. So it's kind of like rocking with Jen, because they're a bit, happy, and well, it's their happy clappy kind of way of doing things. But yeah, so bit upbeat and having a right good giggle, so that's really nice. But I'm missing my friends and my family, because I'm up in Devon and all of my friends are in Plymouth, and my family's in Plymouth, so I'm missing driving, actually, because that's one thing that I was doing every day.
Yeah, that's interesting. Good point.
Because obviously going to university every single day near enough, and I'm not driving anywhere. I'm not even driving my children to school because they're catching the bus. So not even driving. It's just, my family would say sleep, I think. I enjoy sleep.
I do usually say sleep. Yeah, sleep. It's funny about the driving as well, because I realised that because every day you drive in and I'm listening to the radio, I don't know any of like the new songs, because where usually you pick them up because you're in the car listening to the radio. That's so true.
And current things that are going on, because you hear it on the radio quite a bit, and you don't even realise that you're hearing it.
Yeah,
you're nodding along to it.
I definitely agree to all that.
Yeah. I was going to say, Matt, over to you. What's your sort of favourite thing to be doing?
Keeping active. Mine's definitely fitness as well. Since lockdown, trying to do something every day, but I've actually since lockdown got back into swimming. So I used to swim quite a lot when I was younger, back up in Bristol. But I've actually now going to Devil's Point, where the sea is in Plymouth, and I've been doing that every day, which I haven't done for a while. So since lockdown,
that's brilliant.
So that's been good. But definitely from a family perspective, not seeing my nephew, who's almost 1 now. So he got born just before lockdown. So yeah, that's a bit of a tough one. So yeah, definitely that.
Yeah, you do. It's when you've got little ones around you, it feels like a bigger miss because they're changing before your eyes anyway. So when you don't see them for a little while, I've got
definitely. Each time I see a picture of him, he's changed, definitely.
Yeah. No.
Even when they're with you, Sam, you just, I looked this morning, I thought my eldest is turned into a real young woman. She's doing her GCSEs at the moment. She started her mocks today, and it's just gone from being, let's hang out with friends, and it's just all changed. It's odd.
Yeah.
Only been a year, hasn't it,
Yeah. But I guess, in a way, it has shown us all the things that are really important to us.
Definitely.
So I don't know if Lottie's put anything in the chat or is just so absorbed in listening to our stories. But really, why we use this exercise to really get us to think about what's important to us, what it means to us, and also how we might feel if we couldn't do that. And I guess more than ever, this feels really, really appropriate and slightly doom and gloom, actually. But this is, usually we're living in a time where it's not coronavirus and we can do all of these things. So without even having to say, if you broke your leg or, anything like that, it's just about thinking about, we've already said it in that we're not really doing those things, or we're having to strategize to do them slightly different. So I think already everyone's having to think about all the stuff that they're missing out on anyway. So as occupational therapists, I guess our main role is to think in that way. So we're constantly thinking about people's meaningful occupations, their meaningful activities, and considering not just getting people fit and well and out of a hospital, or not seeing a GP, not using services, not using health and mental health services, but actually getting people to do all of those things that are meaningful. So we're not just about fixing that human body, giving people medication, but we're actually looking at the bigger picture of, well, who are you and how can we get you back doing those things when when you are unwell, whether it's physical health, you've broken your hip, you're living with a long-term condition, or you are living with depression or a mental health condition, you're a child that's not developing in the way that's expected of them, you're an older adult who is maybe living alone and doesn't have that family support around them. How do we get that person re-engaging in the community? So I guess in essence, we're during this period of time, it's just highlighted the importance of all the things that we as OTs are thinking about on a day-to-day basis. And we are looking at getting people back doing those things that matter. So yeah. Okay, so this is the section where we usually use a few case studies, really, just to help illustrate the sort of patients or service users that we might be working with in practice, and thinking about the sort of activities they do in day-to-day life. Obviously, these are just made-up people, but the sort of things you need to get up to on a daily basis, and how an OT might work with them to achieve their full potential to get them back doing those things. So I'm going to flip straight to our first case study. So our case study one is Annie Jones, and in this case study, she's a 70-year-old woman with long-standing rheumatoid arthritis. And her condition mainly affects the small joints in her hands, feet and wrists, which are painful and inflamed with some deformity. And for a little bit of background information, she lives alone in a 2-story house and her son lives abroad, the lucky devil. So it's thinking about if you think about yourself, or you think about Annie as a person, if you were dealing with someone, or you knew of someone who had hands, feet and wrists that were sore and painful and inflamed, how might that affect day-to-day life? So it's thinking about all the things that you do with your hands. If you even think about your own day-to-day, I think for me, trying to work on a computer all day would be really difficult at the minute with, Zoom calls and typing and marking. I would definitely be struggling. So if you think about, how much we use our hands, and if they were in pain all day, how we might feel. So I guess there's lots of areas in which Annie would be affected in her day-to-day life, and therefore be impacted in not being able to engage in all of those different activities that she would like to engage in, whether it was, showering, going to the toilet, walking around, eating, opening jars, gardening, pouring a kettle, typing, texting, whatever Annie is trying to get up to in a day-to-day, pretty much all of them will probably need her hands in some way, shape or form. And her life would be quite impacted from that. So as an OT, I guess it's thinking about the role that we would have in considering who Annie is as a person, what is meaningful to her. So, she's 70 years old, so she may be retired. What does she get up to in her day-to-day life? Does she, is she still working? Does she volunteer? Does she look after her grandchildren? Is she a carer for somebody else? There's all these unknowns that we would be unpicking as an OT in order to understand who Annie was as a person. And then we would really be considering what Annie really wants to achieve in her day-to-day life, and we would focus on those areas. So, we'd be considering if she's in a lot of pain, is there something that we can explore to help her manage that more successfully? Can we try different psychological strategies to help manage that pain? Do we need to touch base with her GP and other members of that multidisciplinary team to help with, when she's taking her medication in Annie's care, I guess. We're picking apart all these day-to-day activities and trying to help Annie problem solve and come up with strategies so that she can still live her day-to-day life. I don't know if there's anything else you guys wanted to add about Annie.
If her son lives abroad, what kind of support that she would get in her day-to-day? Whether she does her own shopping, whether she gets somebody else to do it, is she friendly with her neighbours, those kind of things. So it's her mental health as well as her physical.
Yeah, really good point. So as OTs, because we are dual trained in physical health and mental health from a very physical point of view, but also from a psychological point of view. So considering, if her son lives abroad, who else is around to support her? Who's in her social bubble that's supporting her and her day-to-day life. So good point. So just an example of something that might on the surface seem quite simple, and I guess how we unpick it as occupational therapists. So there is a previously fit and able 75-year-old who lives in sheltered housing. So in potentially a flat or house where there's some support potentially available to him. And in this case study, about a month ago, Mr. Parsi had a left hemisphere stroke, and he has made a good recovery, although his right arm, which is his dominant side, and legs and body and facial muscles, that side of his body on the right side, are weakened. And he also admits to feeling quite low about his condition and quite anxious about returning home. So again, a very classic case that we would deal with as occupational therapists. So considering, again, thinking about yourself, but thinking about Carl if he was a real person, if you can't use half of your body, the activities that you might struggle with on a day-to-day basis. If your right side was weakened in terms, very similar to Annie potentially in the upper limb, but also if you think about movement, trying to walk around, trying to climb stairs, trying to stand, all of those sort of activities that we do every day without even realizing, or even thinking about some of our, the activities we highlighted about, spinning and cycling and getting to church and singing and swimming. All of those things would be made significantly difficult for someone like Carl, who's recently had a stroke. And if those things were as meaningful to him as they are to us, they would be things that he wanted to get back to. So it would be thinking about how can we work with Carl, potentially to get back to doing some very sort of basic fundamental human tasks, such as eating and moving around his home, to eventually get back to, whether it's swimming, cycling, getting out into the community, singing in his local church, all of the things that might be meaningful to somebody like Carl. Two very different settings, I guess, Annie and Carl, that would come into contact with an occupational therapist. Then another case study, we have Roger, who is 85 years old and is a retired doctor living alone in a large detached house. So Dr. Allen, very independent, but recently his family have noticed that he's begun to forget people's names and that he's generally awake throughout the night, and was recently found wandering in the streets at night, quite distressed and apparently lost. So his family were concerned that he's not eating properly, he's not taking his medication that he needs to take, and therefore was referred to occupational therapy. So again, already you might be thinking about the potential conditions that Dr. Allen, Roger, is facing, whether it's something quite cognitive. Is this is this something acute? Is he unwell? Why is he disorientated? Or is this something a bit more deeper? Is this the start of potentially an Alzheimer's or a dementia? And I guess depending on that would depend how you would work with him, but that's still same focus on what would be meaningful to Alan, to Roger, not Alan, and what is meaningful to him, and what he still wants to get up to. And again, a lot of OTs might work in this area with people living with dementias and different types of Alzheimer's disease, despite the fact that they are potentially losing areas of memory, of cognition, whether that's short-term memory, long-term memory, how those people can still manage day-to-day life as independently as possible, even Roger at 85, and still do the meaningful things that matter to him and are important. So you can see, hopefully, that there's this real link that's running through all of these case studies, in that despite that they all will be presenting very differently, they're all completely different people, as OTs, we would still be focusing in on how can we still get them doing the things that are important to them, despite, physical or psychological illness. And then the final case study is Dora. So Dora is 3, and it's thought that she had experienced oxygen deprivation at birth. So she lives with her parents and 2 older brothers in a 2-storey home. And her parents became quite concerned about Dora's delayed development when she's compared to her sort of older siblings. And in particular, they identified areas of sort of delayed speech, delayed language, mobility and movement issues. And the example given here is floppiness in her limbs. So her arms and legs being quite floppy and quite delayed in the sort of expected activities that a 3-year-old might be engaging in. So again, very different patient or Dora's might present very differently to Roger at 85, and have different expectations. So although we might, the role that we would play in a children's service would be very different. We would be thinking about, well, what is Dora expected to be doing as a 3-year-old? So we'd be looking at her development, what movements should she be making? How should she be functioning? Because I guess she's at the other end of the spectrum where she's learning everything new. So when we work with adults, we're usually retraining them to do the activities they already know how to do. But with Dora, she's learning everything for the first time. So with Dora, we might be thinking about, well, what is she supposed to be doing? What is she interested in? A lot of the time it might be around play in order to develop those skills, whether they are functional skills or social skills. And how might we do that despite the fact that she potentially has experienced oxygen deprivation, whether this is some sort of cerebral palsy potentially, is it some kind of deficit that can be improved with time? We've left it quite open on purpose to give a little bit of context but not give the game away, in that we would work, how can we develop Dora's upper body strength? How can we help her make those movements that she needs to make? And potentially, put in place strategies for both Dora, her brothers and the parents to help Dora be engaging in sort of her play activities, toileting as a 3-year-old, all of the things that a 3-year-old should be doing as a 3-year-old, really. So hopefully that's helped explore what it means to be an occupational therapist across those age ranges, in a fairly simplistic way. Obviously, the depth that you would go into if you worked in that area would be far superior. But I guess I don't want to bore you guys to death in the sort of next hour and so that we have. Okay. Have you got any questions at that point, or anything anyone wants to add?
Nothing on the chat so far. Lottie did put on the chat that this was really helpful, though, so that's good.
Oh, good. Oh, good. I'm glad.
Thanks, Lottie.
Fab. Okay, so I'll just carry on then. So I guess the case studies were really just to illustrate that occupational therapists work across a range of illnesses, disabilities, and life events. Acknowledging the impact that they have can be quite significant. So thinking about, from your sort of broken arms, broken legs, fractured hips, to stress in the workplace, dealing with a mental health condition and the impact that also has on, day-to-day life, and potentially being an older adult, being socially isolated, the impact of loneliness. So all of these areas of day-to-day life that can sometimes be passed by quite easily. Our job as OTs is to really explore and understand the impact different illnesses, disabilities can have on day-to-day life, and help people to manage despite that. So it's not seeing those disabilities or illnesses as a barrier to still being able to be the person that you are. Yeah, and I guess also acknowledging that everybody is different. So we don't have a kind of, it's not like what's the word I'm looking for? We don't treat everybody the same. It's not a conveyor belt.
One size fits all.
Everyone. Absolutely, yeah. So it's, we work with people in such a way where we get to know them a little bit more potentially than other professions might, because that's really important to us and part of the therapy that we provide. Getting to know someone and showing them that we are really interested in all the things that do matter to them. So that's really important. So I guess the the final pitch on that is about thinking about occupational therapies enabling people, enabling individuals to engage in their meaningful activities, just in a range of ways. And it is really about the person in front of us. You know, we all ourselves, although they were slightly physical focused, we all have a range of activities that we like to do on a day-to-day basis. And that's, you know, that's what's really important to us, is what is important to you. I guess that's the slogan.
Your voice all right, Sam? Do you need a break?
Yeah, I mean, feel free to cut in if you would like to.
Well, I'm actually, for this slide, I was thinking we could get Claire to cut in, and then I'm going to cut in on the slide afterwards because that's about placements. But Claire, why don't you tell us a bit about what it's like studying occupational therapy at the University of Plymouth?
So I'm a more older student. So there are quite a few older students. There's quite a mixture in our cohort at the moment, men and women, not as many men. I think there's more coming up behind me in that sense, in year one. I would say that at the beginning, it's quite daunting, as any other course is. I think they are so really friendly. The lecturers are really informative. They're really helpful, and it's really quite fun to learn. You work across all of the different professions for some modules. So the SOPI modules are all from so like the physiotherapists, the dietetics, the optometrists, paramedicine, all of those, which is really lovely to be able to get a good insight in what other professions do within obviously the uni and on the same site. The rest of the lectures are really informative. They're not some. Obviously, Sam's produced a PowerPoint for this evening. That's PowerPoint, and it's quite interactive, so you can join in. We've made things out of pasta. We've made things out of how can I put it? Marshmallows and things like that. We've had real good fun. We've made at Christmas time outfits out of art materials. We've done hearts and different parts of the body and different things like that, using arts and crafts and different things. So it's really quite informative, and it's fun. So it's a fun way of learning. So it's not just sitting in a lecture theatre writing notes, but obviously that is part of it, and essays are part of it, exams are part of it. But I've made some amazing friends in the time that we were in lectures. Obviously it's a little bit different now because of COVID, so it's quite a lot of most of it is online and over this kind of format, which we've had to get used to. But I think we've adapted really well with that. The university's understood how that can be quite testing at times, but we've been supported along the way. And I mean, I was group rep last year, now ambassador this year. So your years, you choose a group rep. And what I've really liked about it is the fact that you're on certain days. So at university, you're only in on certain days, so you've got a footprint. So if you've got other, say, like work or anything else that you can obviously join in with. I'm also dyslexic, so I get support via the university with that as well. There's the learning cafe that you can go up and use, and there's lots of different ways of learning and having support. So yeah, is there anything I've missed, Jen?
No. I think we'll cover a bit more of the, I guess, a bit of sort of the structure of what it looks like through the next few slides. So actually, that was really helpful. Thank you, Claire. And I think it gives a much better perspective than what Sam and I can give, because you're living it and breathing it at the moment. And I think it's important to acknowledge that yes, a lot of our teaching is well, the majority of our teaching is online at the moment, but we think that we've adapted to that quite well. And as much as we're desperate to all get back into a classroom with you guys, we like to think that we've done an all right job at supporting you.
And just obviously looking at the photo, and I can't believe I forgot that. And we've baked. We baked biscuits and cookies and things.
You did.
So that was really good as well. And we've wheeled on wheelchairs and used, we've done our manual handling and different things like that. So it's been really fun.
That was really good. We've actually got a question. Sorry, I'm not sure what happened to my camera. It froze and now I'm not allowed to turn it back on for some reason, but I am still here.
Okay.
We've got a quick question, if I'm happy to ask it now, if that's okay.
Yes.
So what would you say the proportion of students that come straight from colleges onto the course?
Oh, that's a really good question. I think, I'm not sure that anybody's got the actual statistic, but I think what Claire said is quite accurate. We've got a real mix, and we certainly have a good number of students who are straight from college, who are 18. We've got, a big group of students who are sort of 18, 19, 20, definitely. But one of the things about this profession is that there are lots of people that discover it a bit later on, or they come back to it when they've had a family. And we've had that a lot. But what that really means is that we then have these lovely cohorts who come from a variety of different backgrounds and have a variety of different experience. And then everybody brings something unique to the table. So we definitely have a good chunk of sort of school leavers and college leavers coming onto the programs, but there are also people sort of from all other age groups as well. So I'd say it was a good mix. Lottie, would you guys agree?
Yeah, I think it's quite a good split. I would say there's probably a fairly good distribution between having half our students in that bracket who have come from A-levels, college, foundation courses, to students that have come at it, maybe a couple of years later, or have studied something else, decided it's not for them and come into OT, or like you said, have had a family, had a different career. And I think that's what that provides, or what I feel like it provides, or what I see it provides, is that you can then build on each other's knowledge, or each other's different experiences. So to know those that are coming that have had other careers or professions, already know how to write, have skills in academic writing, and they can share those, or they've experienced different aspects of OT for themselves, so they can give a real insight into that. And then, you've got the students who have come straight from study and are really equipped to, learn things quickly and share that and get on with the tech, and can teach, other students the sort of using evidence and finding things really quickly. And I think that that sharing of information I've seen it work really nicely.
To my surprise, I was a bit nervous going in, being an older student, and I've made some really good friends that are school leavers, which they've helped me learn so much, and especially with the technology side of things, they've been amazing. And I've even gone up to Exeter and visited one or a couple, and being, or gone on the Hoe with a few more, and it's really surprising how you can actually the different age groups work together.
That's perfect. We have another one here, if that's okay. It's basically asking, on average, what the cohort size are for each year.
Oh, that's a good question.
Yeah.
It's about 50, give or take. So our BSc, so our undergraduate programme, is usually, well, actually, it's changing now, because we're splitting that number, I think, between a new programme that we've recently had approved, which is called the MOCFA, which is an integrated master's, and the BSc, so the undergraduate programme. So the BSc is the 3-year programme, and then the integrated master's is a 4-year one. it would feel, if in your first year as a BSc student, it would feel like a cohort of about 50, because you would be studying with the MOC first students in that first year, and really in those first 3 years. So I'd say it would feel like a cohort of around about 50. And then sometimes you would occasionally also have some teaching with our pre-registration masters students who are on sort of an accelerated programme. Occasionally we interlink with them and do joint sessions. And then you'd be looking at a cohort of somewhere between 70 and 90. But also it's important, I think, to acknowledge that even though that cohort sounds quite big, when I say 50 people, a lot of the sessions are split up. So the lectures, you might be in a full cohort, but then you'd be potentially in workshops with half a cohort, so with about 25 students. And then as you progress through the programs, we do a lot of PBL, or problem-based learning, which then puts you into even smaller groups. So you'd find yourself working in groups of sort of between 5 and 12 students. Would that be fair to say, Claire, do you think?
Yeah, very much so. Or sometimes I think there was about 8 of us. Quite, and that was really nice. And that's different people that you haven't worked with before, which is really nice. Yes. So you're constantly learning about other people and working with other people, which is extremely can be quite challenging, but it's extremely enjoyable as well. So
that answers your question, Lottie. Yeah,
that's perfect. No additional questions at the moment.
Okie dokie. I'm going to ask Sam to move on to the next slide, please. And the next thing to talk about is practice placement. So as part of my role within the university, I suppose I manage the placements for our occupational therapy students. And basically, I didn't realise this until my boss said it to me the other day, but your placements make up a third of the whole programme. If you're doing a 3-year undergraduate course, placements make up a third of the time that you're at university. So they're actually a really big chunk of your studies. Essentially, you would undertake 3 practice placements. So you would go into one of the many settings that we've already talked about, and have a qualified and registered occupational therapist as your practice educator, and you would spend 7 weeks in your first year, 9 weeks in your second year, and 12 weeks in your third year on a placement. And each of those placements would be different. And the aim is that you get an overview of 3 different areas where occupational therapists would work. And then each of those placements gets increasingly challenging in terms of what's expected of you, with the aim that when you finish that final placement in your final year after those 12 weeks, you're at a level that would be considered as an entry level or a newly qualified occupational therapist. So you spend in total around about 1,000 hours in practice within health or social care teams, and we are consistently growing our profile in terms of the different areas of practice that we offer placements in, and that's reflective of how our profession is still changing and evolving, and actually OTs are popping up all over the place, which is brilliant, because we think that we've got a lot to offer the world, and our skills sometimes perhaps go unnoticed. So we like to promote that, and we do that by doing things like role emerging placements. So the placement that Claire's talked about, where she's working with a theatre company. A placement I'm overseeing at the moment in a mainstream school is role emerging, because occupational therapists don't tend to work in mainstream schools specifically, or if they do, it's certainly not on any kind of a full-time basis. We're looking at, we've got placements in sort of central Plymouth, working with refugees, people who are homeless. Also, we're looking at emerging settings like GP surgeries and primary care settings, as well as the other sort of obvious and more predictable areas of practice like hospitals, community settings like like where I've worked, or mental health settings and children's services. But really the aim is to give our students a real taste of what it's like to be an OT, and start to put into practice all of the theory that we teach during the time that they're at university. And I think that I would probably guess that around 95% of our students would probably say that placement's the best part of their programmes, and usually once they're on placement they don't want to come off and come back to university. But unfortunately they have to. But yes, that's our placements in a nutshell. I don't know if there are any questions about placements at all, or if there's anything I've missed that's glaringly obvious that I should have said.
I think so.
Cool. I'll have the next slide, please, then, Sam.
You may have it.
Oh, this is a good one too for me to talk about. So, as well as placements, we run a number of different modules, and Claire's already said that we try and teach in lots of different ways, and try and engage our students in communities, outside of just placements. And so there's a variety of different things that our students have done on this slide. So raising money for charity, showcasing the value of volunteering, and down in the bottom corner there, we've got SenseAware, which is an organisation that was set up by some of our they're graduates now, but they were students at the time of setting it up. And then also there's a module that we run in the first year, which is focused on community engagement, and normally we set up some lovely opportunities for our students to get outside or get out into the community and engage. Examples of the module just passed include Dartmoor. I think we were up on Dartmoor chopping up wood and clearing gorse bushes for butterfly habitats, and we were in care homes. I think we had some students. We were at where SenseAware is, Routeways, which is an organisation for young people. We had some students go there.
The zoo.
We're at the zoo.
Oh, the zoo, of course.
We were at the zoo next to the big cat enclosure. That was amazing. Doing all the shrubs and all the brambles and making sure they were all disappeared. And but that was a mental health charity that obviously worked with Growth Good. So that was really good. That was a really enjoyable day, although we had all the seasons in one day that day. We had snow, rain, sleet, everything.
Oh, yes.
So, yeah.
Yeah, we decided that module runs in February, which is an interesting time for it to run, because usually it involves some level of outdoorsiness. And one of our international students, it was the first time they'd ever seen snow. It was a day up on Dartmoor. It was, yeah. So there you go. Is there anything else you want to say about that slide, Sam?
No, not really. I mean, it's funny that we've got Claire with us, because I know you raised money for the zoo as well, didn't you?
Yes, I did.
You did your sort of charity head shave.
Yeah, my head shaved.
Yeah.
My hair shaved. Raised, I think it was around £500-600 I ended up raising. But,
amazing. Yeah, so...
it's been cut about 6 times since then, but yeah. And that was only during lockdown.
And yeah, I mean, previously we've supported students with a range of sort of, running the half marathon, skydiving, raising money for the local community and different organisations. So, something, we're really proud of our students and the sort of activities that they get involved in. So, yeah.
Lottie's just asked, what was a module called that links to volunteering?
Oh, my goodness me. I can tell you the module code.
I'm putting you on the spot now, aren't I?
Hang on, I'll grab it.
Wasn't that 402?
So, yes.
It used to be 404, but it's now OCT 409, and it is called, it's a long one, Occupational Studies, Humans as Occupational Beings Through Community Engagement.
Good title.
It's really catchy, isn't it? We just know it as 409.
Yeah, great module.
It is, yeah.
They're all really good modules, to be fair.
Oh, that's nice. It's nice to hear you say that, Claire.
Yeah.
It's I mean, they are sometimes really taxing. They're really hard to get your head around, but that's what you're there for. That's what you're there to learn. So,
yeah, you're right. Yep. So quite appropriate, really.
Yeah. Yeah. Would you like me to carry on, Sam, or what? I'm happy to.
I will. If you just, you'll have to hand signal at me, and I'll jump in if you need me.
Okay. So we like to try and think about a range of different ways of teaching and enabling our students to learn. And that's because we acknowledge that our students have got a variety of different learning styles, but also we want to acknowledge, I suppose, the practical nature of our profession as well. So it's not realistic to say that, you'll be sat in a classroom, like what Claire said, you're not sat in a classroom just in lectures the whole time writing notes, because actually that's not reflective of who we are and what we do. So we like to try and engage our students in loads of different ways. And so we've already talked about the lecture formats. We've talked about how you could be split up into smaller groups and do workshops, and then problem-based learning, or PBL, as well, which is a smaller group sessions where usually you get given a case study similar to the case studies that Sam introduced you to earlier in the presentation, and as a group of say 7 or 8 students, you problem solve and work on that case study and decide on what sort of interventions or goals you might set for that person. We do teach an element of anatomy and physiology. You can see our skeleton there on the poised. Oh, you have. Go on. What are you going to say?
That was really good, Jen. Those sessions, because we used post-it notes to actually put our different body parts on our actual body, so we knew which parts of the bones or the muscles and different things like that. So that was interesting.
And I think it's important to acknowledge we don't have a huge amount of anatomy and physiology teaching on the programme, partially because actually a lot of that learning occurs when you're out on placement. You learn a lot more about conditions and physiology, I suppose. But actually we give you that basic understanding, because it's important that we know how our bodies work. And so you're introduced to anatomy and physiology in a module in the first year, but then you take that knowledge and build on it through the more practical side of things. And then there's an example of some a hand therapy session up in the top there, where students have made different. Sam, what's the word I'm looking for?
Splints.
Say again. Splints, yes, splinting. Gosh, it's been a long time since I've done splinting. So making splints, hand splints. And then also there's a picture in the bottom left, which is another of our students, which I'm assuming that's a poster that was presented at a conference, but it also acknowledges that we assess in different ways too. So we don't just ask students to write reams and reams of essays. Admittedly, there are a lot of essays, but we also assess in different ways. You could be asked to design a poster. You might have a presentation, or there might be an exam. We don't just assess in essay format, and our essays also sometimes differ as well in the style. So there's one where you need to do an activity analysis. There's one where you need to write a business case for an innovative idea that you've had. There's the
room designs.
Room design, good one. I forgot about that. That's a good example, Claire. There's so we assess in lots of different ways as well, and we also like to get you out of the building and get you learning out and about. So up in the top right corner there, that's 2 of our lecturers at a conference that was specifically for adaptations, equipment and adaptations. I went to that conference too. It's very interesting. But it's another really great way for students to learn and to see what's out there and the sort of new and innovative ideas that are coming through that might be implemented in our practice. So lots of different ways to learn, lots of different ways to be assessed. What haven't I said, Sam?
I think you've pretty much covered it. But yeah, I think it's just important to acknowledge that, you know, we're not just looking for people who are really academic, I guess. It's about, we really value our students for the skills that they bring to the table that are, not just written stuff. So it's about being creative, it's about being able to problem solve and engage with other students. And so therefore we are trying to assess you in a way that doesn't just create someone who's really good at writing assignments, but we want you to develop skills across the board in a range of areas, so that when you leave university, you have the skills to be the best sort of occupational therapist and health professional that you can be. So, I guess it's just important to acknowledge that, we're looking for people who have a range of skills. And I guess that's why we have such a range of students from a range of backgrounds, whether it's from, college, from A-levels, from different types of study to previous life experience, because we put a value on other things too. So I'll move the slide along.
Awesome. Yeah, and I said, go on, you go.
Oh, I've skipped on again. Yes, it's kind of, I've just said, we've just talked about really what this is, but we get our students to consider, like we did right at the beginning of this talk, to think about your own meaningful occupations, your own meaningful activities. And I think, and Claire, you can either back me up or disagree, in that we really get you to consider what is important to you, so that you can see firsthand the impact of that therapy on yourself, essentially, and the impact that engaging in meaningful occupations and doing the things that matter to you has then on your own health and well-being. And we hope that throughout the programme, in those activities we get you to do, and that kind of exploratory learning where we get you out into the community, you do your placements, it's a real hands-on experience to not just read from the books and the literature that we expect of you, but to really get hands-on and see that therapy happening in practice too.
And I think, Sam, what's really important is that from an early on, you are taught and encouraged to explore your own reflections on engaging in your learning and your meaningful occupation. So then you're learning further, and you're going deeper. So you're kind of understanding why you're doing what you're doing and how you're doing it, and what you can change in the future. So, and you're certainly doing that through placement.
Yeah, absolutely. Yeah, it's that real place where you start to bring it all together. And I guess this next slide was really, it was in the title, research and practice, in that we also, value research. And in our team, we have a range of backgrounds. And I think, our team is created on the basis that we have people with a range of skills from different backgrounds on purpose, so that our students can get a really valuable and different experience from each and every one of us. And a lot of us have different types of training, different types of clinical expertise. That means we can give you that well-rounded idea of what occupation can be, and occupational therapy can be. And we, our students do get involved in that. So we do run a range of different research projects. So Dr. Alison Warren, who's our academic lead in occupational therapy, runs an Alzheimer's Society studentship every year. And that gets a student involved in a research project of their own, really, to, get a flavour of what it means to be working in research, and getting involved in sort of the Alzheimer's Society as an organisation. And we also have students that go on from sort of BSc level study. We've got our MOC now, but also the traditional MSc pathways, and also PhD. So myself, I'm studying a PhD. So being able to share those experiences from a kind of research and evidence-based point of view, but also, I guess, attempting to demonstrate that, you know, there's different routes of occupational therapy, and that the team in ourselves, without backing myself too much, are able to bring to you that experience that is, you know, is continually growing. So we're all passionate about research. We use evidence in our practice, and it is contemporary, in order to give you that, you know, the best experience possible. So
yeah, nice.
And then it keeps skipping out me, and you've lost me as well. You just have my cheesy photo now. But I guess it was also just to highlight that we not only think we're great, but the Complete University Guide also thinks we're pretty fantastic. And our rating this year is 5th in the UK. So we're really proud of that. And I think that shows, you know, it shows hopefully the dedication we have. You know, it's based on a range of variables around student satisfaction, our research profiles, the expectations of our students that we have. So it's based on a range of categories. That means that we sit that high. So we're really proud of that. I wanted to share it, I guess.
And I just wanted to add, Sam, is that being a class rep last year, you really do listen to any suggestions or things that possibly can change, that we think that could change. You know, they all listen to anything that, if there's any things that were challenging, or maybe they could do things differently, and they really take on board what you have to say and try and change it for the following year, or change it straight away. And I think not many, I mean, I've gone to a couple of universities, so not many universities do that. And they really take on board what their students are obviously experiencing and what they're needing. So
yeah, thanks, Claire. It's nice. It's nice to hear, actually.
Yeah, it is.
So I guess that's kind of it from us. I hope that's been a bit of a taster. I guess just to highlight that we are on as a university team. So as a teaching team, we're on Twitter and Facebook. So we do try and keep fairly active on there with updates. You know, we're really proud of our students. So whenever something's happening, we like to shout about it. And you know, feel free to use those also as platforms for questions and things if you do use them. And the Royal College of OT, which is one of the boards that we're accredited by to meet their standards for registration, their website's also on there as well. So that gives you some more useful information about what occupational therapy is, and just some more information for further reading, I guess. And I guess at this point, I can stop sharing and see if there's any more questions in the chat, or Claire, if there's anything else you want to add, and Matt.
I know I definitely learned a lot, Rev, 100%. I've quickly just messaged Lottie to see if she's got any additional questions, so I'll just give her a couple of minutes to come back. But yeah, I've definitely learned a lot. Thank you very much for that. It's really intriguing.
You're welcome.
This is my first session as well, so it's quite informative for me. It's good.
You know what we do.
Lottie's just come back saying, no, that's all her questions answered. Thank you very much. Really helpful.
Oh, lovely.
Oh, great. Well, good luck, Lottie, with whatever you decide to do in the future. And if you do have any questions, feel free to give any of us a shout, drop us an email, or I don't know what the formal way of getting in touch is, but happy to chat further if needed.
Absolutely.
Thank you, everyone. That's really helpful.
All right.